Hello, my name is Gina Gray and I'm gonna be doing the inserting and discontinuing IV for Nightingale skill video. Okay, so I'm gonna do my hand hygiene. I'm gonna have my supplies ready for the inserting of the IV. I have the IV start kit. I have the set for the extension set with the tubing. I have a needle here. This is a 24 gauge by 56 inch 0.56 inch length, abnormal saline, and have gloves. So for this patient is an elderly patient with a very thin vein, so we're just gonna do a 24 gauge. Okay, I'm gonna do hand hygiene. I'm gonna put on my gloves, and also because I used up my 22 gauge, I don't have that needle anymore. So for my first step, I'm gonna go ahead and prime my tube. You're gonna prime the tube with the saline. You're gonna see some drops here, there. Just gonna set it aside here. Okay, we have already determined where we wanna cannulate this patient. So now we are gonna put on the tourniquet. We're gonna put the tourniquet about 4 to 6 inches above where we wanna do it. And we wanna make sure that when we put the tourniquet, it's not too tight. So we wanna check the distal pulse for the patient, make sure that it's still there. Okay, and then for this patient, what we're gonna be using is alcohol. So we're gonna clean the site with alcohol. You want to go from inward to outward motion. Discard the alcohol pad. We're going to wait for it to dry about 15 to 20 seconds. We're going to go ahead and open our needle. The 24 gauge for a very elderly patient with weak veins. Okay. We're going to have when you insert the needle, I want to pull the skin back. Where I want to put the skin back is about 1 to 2 inches below the insertion. I'm gonna pull it back, against the skin, and then we're gonna insert the needle with the bevel up about 30-degree angle. Okay, and then watch for a flashback. Once you get a flashback, that's when you straighten your needle out and try to advance it more, about half a quarter of an inch more. Okay, and then once you're there, you want to stabilize it. And you want to move with your index the hub, so it's like close to the skin, and then you also want to retract the needle. So you're gonna press the release button, so you're gonna move the needle. Okay, and then so you have the needle. You want to discard that needle. You still want to stabilize it with your non-dominant hand, and then you want to remove the tourniquet. So now we remove the tourniquet. We'll quickly, you want to quickly connect the tube. Okay, and what we want to do is we want to aspirate, make sure that we're in the vein, and then push the saline back. You want to watch out for some infiltration symptoms, like it becomes big and then you get a bleb. So now, okay, you see it's fine. What we want to do now is get our gonna get our, what do you call this? Dressing, and we're gonna put it over it. Make sure you keep the sterility. Just put it over top. Okay. Remove the here, and then you wanna loop. You wanna loop it and tape it up. Okay. Actually, you wanna remove this first, and then discard the syringe. Okay, and put a tape there, and you want to put label where you want to say, your initial, the time, the date, what gauge you use, and the size of or the length of that needle. Okay, then you clean up your area and you're done. Okay, remove the gloves, perform hand hygiene, and you come back. We're gonna remove the needle now. So perform hand hygiene, and we're gonna put on new gloves. Okay, so now we want to remove the IV. So I'll remove this label. I'm gonna remove the dressing. I'm gonna stabilize that dressing area. Stabilize the needle. I remove this secondary tape. Okay, we're gonna get a sterile gauze. I'm gonna put it on top of the needle, and we're gonna slowly remove the needle. Slow and steady. Okay, remove it. Then put a little bit of pressure for about 30 seconds to make sure you stop the bleeding. And then you want to look at your IV needle to see if it's still intact and what does it look like? Like is it intact? Is it missing a piece? You want to know that one, so make sure you didn't leave anything behind there. Okay, so you want to discard this into the sharps container. Okay, then after 30 seconds, you want to check if the bleeding has stopped, and you get a new gauze, and you're gonna replace it with a new gauze. Okay, the bleeding has stopped. You're gonna be taping it up. Alright, so you put the tape and you're done. You want to clean up your area and discard all your trash, and make sure that the sharps are in the sharp container. And remove your gloves and do the hand hygiene. Thank you.